and hopefully I'll be able to get through this without coughing too hard. Speaking of healthcare. All right, so thank you so much. My name is Jen Lunsford. I'm the New York State Assembly member for the east side of the county. I am joined here today with our friends from the Community Health Advocates. They're an organization that does individual advocacy for people who are trying to navigate challenging health insurance issues. They have been an incredible partner with our office, and we have been working with them to try to navigate what some of the changes are that we can expect from HR1, which has been referred to by some as the Big Beautiful Bill. We will refer to it as HR1 throughout the course of this presentation. One of the things you're going to hear today is that there are a lot of unknowns, and that is true both from the side of people who are trying to help uh, members navigate insurance issues, but also from the state side. So I wish I had a really clear message for you today about what our policy actions are going to be or what our funding mechanisms are going to be to try to buttress against some of the challenges that are going to arise as changes come to our insurance market. But until we can fully realize the impacts of HR1, we don't really have a lot of those answers. So this is really the beginning of a conversation that I know is going to be ongoing over the course of the next several months, as we learn more about the full impacts of HR1 on our insurance market. But we're really, really lucky to have experts from community health advocates here to help discuss some of what we do know and ways that they can help if you or someone you know find themselves in a situation where they are trying to navigate challenges relating to health insurance. So, with that, I'm going to hand it off to Sarah Santini, who's going to kick it off from the Community Health Advocates. She's going to be doing a presentation, and I'm going to turn off my screen but hang it around. I imagine most of your questions, which some people sent in questions in advance. If you would like to ask questions throughout the presentation, please use the Q&A button located at the bottom of your screen. And we will try to get to those to the extent possible. We're going to try to keep this to an hour. We know, it's a weeknight and we want to be respectful of everybody's time. But also, as you're asking questions, we hope that those can be broader, more general questions. If you have questions about yourself or your own personal healthcare situation, Sarah and Diane will be sharing with you a number that you can call to get more specific advice. Given that this is somewhat legal advice, we cannot give specific, specialized advice. And particularly, you don't want to be sharing all of your healthcare information with our 100 closest friends here on this webinar. But with that, I'm going to hand it off to Sarah, and thank you guys so much for joining us tonight.
Thank you so much, Assemblymember. Good evening, everyone. I'm Sara Santini. I'm the program manager here at Community Health Advocates. I want to thank you all for joining us today to discuss recent federal changes and how those will play out in New York. Like the Assemblymember, we're going to talk about what we know so far. There's still many, many unknowns. So please just hang tight and just know that we're here to support you throughout, this whole process for the months ahead and the years ahead. And I want to thank the Assembly member for hosting the presentation with us and for supporting the Community Health Advocates program. Tonight, I'm going to be co-presenting with Diane Spicer. She's our supervising attorney. So we're going to split the presentation into, I'll take the first portion and she's going to go into all the details of federal changes with every insurance type. So just a few housekeeping rules. The Assembly already mentioned already one of them, but I just want to reiterate, please type your questions in the chat. We will be presenting first because we want to make sure that we talk about and present everything we want to share with you all. And we're going to take on those questions at the end. During the presentation, like she mentioned, we cannot take specific personal questions as we want to keep everyone's information private, but we're happy, of course, to answer any more general questions. And we're going to share our phone number so you can call us directly if you will have a personal situation or a family member or friend. We're happy to, of course, hear those out and help you troubleshoot. But we want to make sure that, yeah, everyone's information remains private. So we're not going to take on personal questions in this workshop. And then the second, just another housekeeping rule is please mute yourself. I believe everyone's already muted. But yeah, we want to just avoid just major disruptions. So with that, we'll start us off. Dan, can you click on the next slide, please? Great. So we're going to talk about what is changing in New York State after these changes. So first off, I'm going to talk and explain to you all a little bit more about community health advocates. So we are a one-stop program for healthcare consumers in New York State. We offer free and confidential assistance related to health coverage and access to care. So we help every New Yorker and anyone in the state of New York with any type of coverage, and also those that don't have health insurance. We speak multiple languages. We have advocates that speak over 25 languages, and we serve all 62 counties through our toll-free helpline, and also 24 community-based organizations across the state that serve folks locally and in person. So a little bit more about community health advocates and the 5 common issues we assist folks with. The first one is getting coverage, so getting health insurance. We help folks look at their different options. We also help people enroll into financial assistance programs such as the Medicare Savings Program or Medicaid. So we help people get coverage. We also when someone has health insurance, we help many people understand how that coverage works and also how to use it. And one thing, of course, is getting the coverage, and then the next, another big portion of it is just really understanding the ins and outs. I mean, what services are covered, which providers you can go see, how you can get prior authorizations, what might need prior authorization, et cetera, et cetera. Number 3, we help folks access care. So that can be from finding a provider within the plan's network to getting a procedure. We also assist with medical bills. We assist with lab bills, hospital bills, doctor bills, just any medical bill that might come your way. And then last but not least, we assist many folks with claim denials. So you probably know of someone, or you yourself might have received a denial from your health insurance plan before. So we assist New Yorkers with denials that they receive from their plan. We help folks understand their rights. We assist providing information about the appeal process, and oftentimes provide representation as well. So how can you reach community health advocates and the advocates we have across the state? So number 1 is through our helpline. There's our helpline number here, 888-614-5400. We are option 3. The helpline is open every business day from 9 a.m. to 4 p.m. So that's Monday to Friday. You can reach us by email. There's our email address here, cha@cssny.org. And you can also find our phone number listed on all Medicaid, Essential Plan, Child Health Plus, Qualified Health Plans, and also state-regulated commercial plans. We're in the explanation of benefits that enrollees receive, and also in the denial notices that enrollees receive. So here you can see a screenshot of where our phone number is located. And then also after the helpline, like I mentioned, we have 24 community-based organizations across the state. The one in your area is Legal Assistance of Western New York, Lonnie. This is their contact information and their address. They provide in-person assistance in your area, so they're also there to support you. So those are the 2 alternatives for in-person or phone assistance. And with that, I'm going to pass it on to Diane to walk us through the federal changes and how will it affect New York.
Good evening, everyone. My name is Diane Spicer. I'm the supervising attorney of the Community Health Advocates Program, and I'm going to talk a little bit about how federal changes will affect New Yorkers and potentially your coverage, and most importantly, how the Community Health Advocates Program can help you if you are affected by some of the changes that will be implemented over the next several years. So in terms of recent federal legislation, many of you know that in July, the federal government passed HR1, or the One Big Beautiful Bill Act. The law makes pretty broad changes to Medicare and Medicaid laws, as well as marketplace plan coverage rules, so Obamacare. Some changes impact beneficiaries and enrollees directly, while others affect state budgets and may result in policy changes or service cuts. The law triggers massive automatic cuts to Medicare and Medicaid unless Congress acts. Some changes are effective immediately, while others will take years to fully implement. And so we'll talk about some of these broad changes. The first topic I'm going to discuss is Medicare and what is changing for Medicare. Um, some of HR1's Medicare eligibility changes. One of the really big changes is that non-citizens with legal immigration statuses are no longer automatically eligible for Medicare, regardless of whether they qualified to receive Social Security, retirement, or disability or railroad benefits, or were lawful residents 65 and older who lived continuously in the United States for 5 years. These two used to be eligibility criteria for Medicare on their own, and they will no longer be for certain non-citizens. For US citizens, nothing has changed, but HR1 limits non-citizen eligibility for Medicare with the following exceptions. People who are lawful permanent residents, sometimes called LPRs or green card holders who have lived continuously in the United States for 5 years, certain immigrants from Cuba or Haiti, and certain immigrants from the Compact of Free Association states are exceptions. All other immigrants, including refugees, asylees, victims of abuse or trafficking, will lose Medicare coverage and future eligibility for Medicare. Um, these changes take effect immediately for people who have not yet reached Medicare eligibility or Medicare age or disability. Those already enrolled will be disenrolled within 18 months of the passage of the One Big Beautiful Bill Act, or HR1. So that is January of 2027. And the Social Security Administration must identify current Medicare beneficiaries who are going to be disenrolled and send them information. We have not received much guidance or information from the federal government on when or how this will work, but we certainly will know ahead of folks getting notices and be able to guide them through what the notice means and what their options are for coverage if they are disenrolled from Medicare. And since we're on the topic of Medicare, I'm going to talk about some important Medicare reminders. There's two Medicare open enrollment seasons, and we're in the middle of one, or one just ended and one is set to start very soon. The Medicare Advantage open enrollment. If you're a Medicare beneficiary, you know that it was just the time to choose a Part D plan or to choose a Medicare Advantage plan. From January 1st to March 31st, it's time for people who are currently enrolled in Medicare Advantage to switch to another plan with or without prescription drug coverage, or switch to original Medicare with or without a Part D plan. And this new coverage takes effect the first of the following month. So if you made a choice that you don't like in the last 3 months, starting January 1st, you can change your Medicare coverage. And the Community Health Advocates Program can help you with that. And this slide explains a little bit more about what we can help Medicare beneficiaries with. Certainly answer questions about Medicare eligibility, coverage options and benefits, compare Medicare plan options. We can help screen folks for cost-sharing assistance programs to help with Medicare costs. And after open enrollment, determine if you have a special enrollment period to join a Medicare plan. So now I'm going to talk a little bit about what's changing for marketplace plans. There's the federal changes also have some pretty sweeping changes to Obamacare and the ACA. And so our marketplace is where those plans are sold. They're called essential plans and qualified health plans. And our marketplace is called the New York State of Health in New York, our federal marketplace. So if you have essential plans, some changes may be coming to you soon. Essential plan coverage for people with incomes between 200 and 200% of the federal poverty level. So that's about $31,000 to $39,000 a year for a single adult. That coverage will be eliminated in July. The state is working on a transition plan to try to keep as many consumers in that income bracket insured as possible, and more information will be out on that soon. So you may have gotten a notice recently saying your coverage may change and to go back to the New York State of Health to explore your options at that point. Um, and we can help you through that transition when it happens. If you're enrolled in a qualified health plan, some changes have already happened and or are happening in the next year or so. Qualified health plans are bronze, silver, gold, platinum, catastrophic plans offered on the New York State of Health. These are private insurance plans that you pay for, and you may or may not, depending upon your income, get tax credits in order to purchase those plans. If you're a non-citizen, you may no longer be eligible for financial assistance and or eligible to buy a qualified health plan on the marketplace. And regardless of your citizenship status, you may have to pay more each month for your health insurance than you did before. And I know there's a lot of information in the news about enhanced premium tax credits and the the Democrats and the Republicans trying to get together a bill to um, either extend enhanced premium tax credits or have an alternative because enhanced premium tax credits will expire at the end of the year. So it's a lot in the news. So if Congress does not act, that will make the cost of health insurance increase for millions of people. So that is a possibility if you have coverage with a QHP through the New York State of Health. And it's important for folks who are enrolled through the New York State of Health, of course, to stay connected. And we have some information here on the latest updates from the New York State of Health. We can also help you to understand all of the changes as they happen. So for this kind of insurance, we can answer your questions about coverage and your coverage options if you are no longer eligible for coverage through the New York State of Health, or the price of health insurance for you goes up a lot in the new year. We can help you understand your options and also connect you to a sister to enroll in those options. And also, we can give you information about access to low-cost care and financial assistance, which I'll talk about in the following section. And now I'll talk just a little bit about what is changing for Medicaid. There are very big changes for Medicaid, and they have not yet been implemented, and they will be implemented over a number of years. But this is what we know so far. If you are under 65 and on Medicaid, changes are projected to be implemented starting in 2027. Um, and those changes are twice a year Medicaid renewal or recertification. So if you are on Medicaid, you know that you have to fill out paperwork. Usually, if you're under 65, it's online. Sometimes it's a paper packet in the mail where you have to write who you live with and your income and lots of different information. You'll have to send that information in twice a year starting in 2027. The retroactive coverage period for Medicaid will be reduced, and there will be work requirements in order to maintain Medicaid eligibility. That will be required for adults age 19 to 64 on Medicaid, and they must engage in at least 80 hours of work per month, education or volunteer activities. to maintain eligibility, and that's looked at in terms of uh, an income threshold. So you have to work a certain amount of hours, but it's also related to the minimum wage and how much you're earning. And there's an exception to these work requirements, which is for pregnant individuals, people with disabilities, parents of children who are 13 or under, and the medically fragile. In terms of maintaining Medicaid eligibility, what we can do is answer your questions about coverage and your coverage options. We can help you keep coverage and connect to people who can help you sign up for coverage if you lose coverage. So we know the recertification once a year is a lot of paperwork. We're expecting twice a year it will really be burdensome for people. So we're here to help you stay covered and to get that paperwork in and to certify any requirements that you need to certify during the course of the year. If you lose coverage or your coverage costs increase, you do have options. Here's a little bit of a bright side and some good news, and in with a lot of not so good news. In New York, we have hospital financial assistance. All New York hospitals must offer free or discounted care called hospital financial assistance to uninsured and underinsured patients who can't afford their bills. Hospital financial assistance is basically an income-based discount on care provided in a hospital setting. You may qualify if you live in New York, your income is below 400% of poverty, so that's about $62,000 a year for a household of one. You're uninsured, or you are insured, but your medical bills amount to more than 10% of your annual income. Or if you have exhausted your insurance, you can apply for hospital financial assistance at any time. Hospitals can't deny care if you have unpaid bills. And they also cannot consider your immigration status, your assets like savings or retirement accounts when it reviews your application. So this is a good alternative for both for cost sharing, if your cost sharing goes up with your insurance, or for folks who are uninsured. New York State also has some relatively new medical debt consumer protections. And those are that providers cannot require a credit card pre-authorization or that a card be on file before treatment. They also, medical debt cannot appear on credit reports or impact credit scores, including debt that's charged on a medical credit card. And that protection does not cover medical debt that you put on a regular consumer credit card. Um, so providers cannot report, credit reporting agencies cannot report medical debt that's late on your credit report. And so it should not adversely impact your ability to get a loan, to take out a mortgage, to get car insurance, for example. And there are some alternative care options in New York if you lose coverage. Hospital-based clinics and health systems, as I said, they all have to have hospital financial assistance policies that help people with low to middle incomes afford their care. So care obtained at these facilities can be obtained with reduced costs. Federally qualified health centers and state and community-based health centers are also an option for folks who may lose their health insurance. And of course, in a medical emergency, emergency departments are must abide by federal rules which require them to stabilize an emergency medical condition and not turn people away, regardless of whether or not they have insurance or what their immigration status is. So always going to an emergency room if you're having an emergency, regardless of your insurance or immigration status, and then we can help you apply for hospital financial assistance to cover those bills thereafter. So just in terms of what we can help you with as it relates to our New York Hospital Financial Assistance Law. The law has recently changed in last year, and those changes are really good for consumers. So we can help you apply for and answer questions about hospital financial assistance, including appealing hospital financial assistance denials, understanding the application form. In fact, our phone number is on the application form. If you need help, you can call us. We can help you find low-cost care options in your area, like different health clinics and prescription assistance programs. We can help you negotiate medical debt and ensure that your bills are accurate, and even appeal if your health insurance was supposed to pay more and your bills are not accurate. And we can advise on other coverage options and connect you to people who can help you sign up for those other forms of coverage. So this is our contact information. If you need help with health insurance coverage, if your coverage is changing, is going to cost more next year, is terminated, if you have medical bills, call our helpline. Our helpline number is 888-614-5400. And we also offer in-person assistance, as Sada said, at Lawny, Law New York, and their phone number is here too, on this slide. And now maybe we can field some questions. Again, I want to remind folks we do not want to talk about specific protected health information in this forum because we have a lot of folks on the call. We'd be happy to confidentially counsel you on your specific insurance issue and regarding your specific health information through our helpline, but are happy to take general questions.
Thank you, Diane. Yes, please, folks, if you have any questions, you can put them in the Q&A function. I answered two as you were presenting. One was if folks will get a copy of the presentation. And yes, the presentation recording will be shared with all the attendings in the days ahead. And then, Dan, you're still screen sharing. And the other question that came up is an assistor the same as a navigator? Maybe navigator is an old term. So yes, a navigator, navigators are a type of assistor. Navigators, CAC, so Certified Application Counselors, and Marketplace Facilitated Enrollers are all types of assistors that can help folks enroll through coverage to the marketplace. Just wanted to clarify that.
It does look like we have a question here about Child Health Plus and Family Health Plus. Are there going to be any changes to Child Health Plus and Family Health Plus?
So Family Health Plus was phased out a number of years ago. We don't have a Family Health Plus program in New York State anymore. There are changes to Child Health Plus in terms of there are federal changes to Child Health Plus that don't affect New York State. That's the kind of the long and short of it is that Child Health Plus shouldn't be affected in New York State. There are definitely federal changes around immigrants' eligibility for Medicaid and for different programs that has a very complicated history around SHPRA, and really, really long answer could happen. But for for New York, there are not going to be changes for Child Health Plus.
We have another question. Should those with Medicaid be told to only go to the hospital in an emergency and not to urgent care facilities?
No. So, my slide about the emergency room being required by federal law to treat people who are coming in with an emergency, regardless of their health insurance status, is not a call to kind of for Medicaid recipients or any kind of health insurance recipients to use the emergency room. I'm just trying to, the point I was trying to get across was that we want to make sure people know if they lose health insurance because of any of these changes, it doesn't mean you can't get care in an emergency. Generally, as someone who's worked in public health law for a long time, I would say that you should use urgent care when you can use urgent care, and you know when your condition maybe is a little bit more serious than the urgent care, right? And our health insurance products in New York, our health plans, all of them have the what's called the prudent layperson rule, which means they must pay for you to go to an emergency if you reasonably believed that you were having an emergency. Let's say you had really bad indigestion, but you thought it was a heart attack. If you reasonably believe that it was a heart attack, it's okay for you to use the emergency room. But I do cringe when I hear, that people go in and out of the emergency room when they really don't need to. So I would say, and I hear this in my own family. I'm like, you did what? So I would say, use the urgent care when it's urgent care, when urgent care is necessary, and be careful about that. But I think the point is that the emergency there's care available to people who have no insurance in this country. And in this state especially, we have a safety net system.
And another question was still no more donut hole.
Right now, still no more donut hole.
Yeah.
I see another question. Was there something in the news not too long ago about the possibility of medical debt being reported to credit agencies?
Yeah. So what was in the news in New York was that a law passed which prohibited medical debt from being reported by credit reporting agencies on a credit report.
Mhm.
And there was also some talk at the end of the Biden administration, some federal talk about the same sort of protection. And the Center for Consumer Protections Bureau did a lot of work around medical debt and protections for credit reporting for consumers. But I believe a lot of that work was kind of unwound and disbanded recently.
Yeah, part of why that bill wasn't passed in prior years was we were waiting for the federal government to do it. And then when it became clear the federal government was not going to do that, then we took matters into our own hands at the state level. Another question is, do you think there's going to be more prior authorization?
Well, I mean, if you're thinking about more prior authorization in terms of um, folks trying to get more care as they have insurance, is that what you're thinking? Potentially. Um, I think, prior authorization rule in New York, we've tried to think about what simplifications we can implement for prior authorization rules, what things don't need to be authorized every 6 months, for example, because they're maintenance. And I know New York public health advocates have done a lot of work around diabetes care in that relation. But yeah, it's possible that there would be more prior authorization, people trying to get care as they uh, are worried that they might lose their insurance in the future.
I think also this is part of what's unknown, because HR1 doesn't actually require an insurance company to implement more prior authorization. But as insurance companies are going to see changing risk pools and changes to reimbursements, then they may change internal policies to reflect those changes that are being forced upon them externally. The impact of HR1 to our healthcare system overall is going to be far reaching, and there's domino effects that we really can't predict. There's domino effects we can predict, that, this is going to be an enormous strain. There's projections that just next year, our healthcare system statewide is going to have about an $8.5 billion loss in Medicaid spends. And that's going to impact, especially our distressed hospitals upstate. You're going to see, I think, rural hospitals uh, maybe closing some departments. You're going to see ORs close, potentially emergency rooms, and that's going to put a lot of strain on our Region 1 trauma centers like Strong here locally, it's going to just create longer wait times for everybody. It's going to drive insurance rates up for everybody. Healthcare is really an ecosystem. And when you put pressure on one side, it's going to bubble up on another side. And that's what's hard right now that I don't think anyone here can predict is just exactly how that's going to manifest as people adjust in the healthcare side, the insurance side, and the user side to accommodate all these changes.
Absolutely. Well said.
Give people, I think, another minute or two for questions. Looks like it's slowed down, and I'm not going to hold people here for an hour if they are satisfied or just too bummed out to ask additional questions, which is also valid. Uh,
I see one more related to tax subsidies. So the person says, I seem to recall that for 2025 ACA tax subsidies, there was a cap on the premiums of 8.5% of your income if your income was under 400% of the federal poverty level. If the subsidies do get extended, one can hope and pray. Do you know if there will be a percentage like that for people with incomes underneath 400% of the federal poverty level?
Yeah, so um the percentage that you're talking about was, and Sada, you can chime in if I'm botching this, but the percentage is tied to the amount you're supposed to be able to afford in a specific percentage of your income you're supposed to be able to spend on health insurance according to the ACA. And so people between 400%. So I don't know what the terms of the extension, if they will extend the subsidies, what they will be. But in New York State, folks under 400% of poverty are eligible for tax credits. And the extended tax credits, the enhanced tax credits, excuse me, were for people between 250 and 500% of poverty. So folks under 400% of poverty will still get tax credits, just maybe not as much tax credits. And I'm not sure um, how that, like what the formula will be or what that will look like in the if the enhanced premium tax credits are extended. However, I want to reassure you that if your income is under 400% of poverty, you are eligible. You are will remain eligible, um, no matter the status of the enhanced premium tax credits, whether they are extended or not. You will remain eligible for tax credits. So the short answer to that is under 400%, you will still get tax credits. It's over, not under. Yeah. So if you're over 400%, then you may not be eligible for any tax credits, depending upon whether the enhanced premium tax credits are extended.
Yeah, and just to add on to that, so folks over 400% of federal poverty level right now, because folks are enrolling to get January 1st coverage, they're already not seeing these enhanced premium tax credits. So they're paying full price premiums. That's the coverage option that's currently there.
And then we have a Medicaid question. Will Medicaid research happen more often? Yes. So instead of happening once a year, they will happen twice a year, biannually. Around every 6 months, you will have to recertify your Medicaid coverage.
there's also a question in the chat asking about the elderly. What's the biggest issues for them besides hikes in the premiums? I know that some people in our area have had their MAO plan wholly disbanded, that their MAO plan is just not even offered anymore. And I know Diane, you spoke earlier about the impacts of people over 65 on Medicaid.
Yeah. So uh, for people under 65 on Medicaid, they'll have this the um, biannual recertification. They'll have work requirements. They'll have changes in retroactive coverage periods. Um, for those who are over 65 and on Medicaid, the changes are in regards to the retroactive coverage periods. But I think important to note one of the things I said on the first slide, and also that the assembly member talked about is that this is going to affect our state budget and the budget of the State Department of Health. And so that has a trickle down effect to all the public health insurance programs that the state manages. They have to make it work with the money that is going to be allocated by the feds and in the state government. So right now, those are the changes that we know for people on Medicaid over 65 and the changes that we know for the Medicare program. But there could be additional changes that are policy changes that the state makes because they are going to have less money.
Yeah, and that brings us to another question, which appears to be more for me. If we're going to have a shortfall in Medicaid funds, why did we have an inflation refund instead of using that money for healthcare? Great question. At the time we passed the budget that included the inflation refund check, that was before the passage of HR1. HR1 wasn't even in discussion at the time that we passed that, and there was a pretty hefty debate over whether the $3.1 billion that was used for inflation refund check could be better spent elsewhere. We ultimately did use less. We didn't use the full 3.1. And there were many, many programs, upstate non-MTA public transit, road money, uh, bolstering our reserves for a potential recession. There's a lot of things we could have done with that money. I will have you know that when I did my constituent survey and I asked all y'all, hey, do you want this money back or should we use it for other things like Medicaid? 80% of you wanted it back. I was of the mindset that maybe we should reserve it for a rainy day, but all of you wanted your money back. And I think that that was overwhelmingly what most people wanted. That was money that was realized entirely from increased sales tax. That was a windfall to the state, money we weren't expecting. So the governor, wanted to return that to the taxpayer. And, that's a question we have every year with the money that we have. This year, we're going in with what I have been told is a no longer bleak, but manageable budget hole of roughly $4.1 billion. But that's just for this year. The next two out years are dismal. And I try not to think too hard about them. But we are going to have a very, very challenging couple years because we can't cut or tax our way into backfilling this entire federal cut. It's just impossible. We've already had to make some substantial changes to the essential plan just to ensure that it will remain solvent moving forward. Another question is, does New York State have the bandwidth to handle increased documentation for recertifications, work requirements met, et cetera? Probably not. Yeah,
Yeah,
well, I'm pretty sure no. I don't think we have the capacity to do it very well right now. Um, so no, but that wasn't our choice. That was foisted upon us, and we will do our best. In fact, we as a state have been passing laws throughout the benefits industry to lengthen time frames for recertification because we understand that we don't have the bandwidth to make it less onerous for people. The impacts of HR1 on healthcare, on SNAP, on higher ed are far-reaching and devastating, and we will just have to figure it out. Thank you for coming to my Thursday night bummer session where we talk about all things that are bad. Um,
well, we do have our hospital financial assistance
yeah,
reforms and our consumer medical debt protection reforms that are very good. In fact, 20 years in the making for the hospital financial
yeah.
assistance reforms, and I'm super proud of that. And thank you, and happy to help consumers um, through those issues.
We've been making referrals to the community health advocates for years, and they are truly a gem. We are incredibly lucky to have them. I simultaneously wish more people knew that you exist and you do this incredible work, but I know that you wouldn't have the bandwidth if everybody knew that you existed and did this incredible work. But truly, not just in this space, but in all the spaces you guys work in at the Community Service Society, um, an incredible service to people in New York. So I'm really glad that we're able to connect people. You know, as any of you who were on our webinar about um, higher ed, you know, we have other community services relating to student loan repayment, lots of community organizations that can help you out. And I think a lot of people don't realize that they can reach out to their state representatives to get matched to people who can provide them services. So if you find yourself spinning your wheels trying to figure out what you're supposed to do, please come to your state assembly person or your state senator. We we're the hub of the wagon wheel, and we know all the people who can help you. So please leverage us. That's what we're here for, is to make sure that you are getting everything that you're entitled to. We're getting a lot of thank yous. You know, and I thank you guys for taking time out of your weeknight. Uh, I'm going to give you 1 more minute to ask questions, and then we're going to let everybody go. Other thank yous. Thank you guys. What's happening with MAID, medical aid, and dying? Also for me. So 155 bills have been called up to the governor's office. There are 4 remaining after she is done with this 10-day period. That last batch of 4 includes medical aid and dying. I cannot tell you what she's going to do. I can say that my gut is that we wouldn't have taken the vote if it wasn't already worked out. She may be waiting until the end of the year to handle that and another somewhat controversial bill about judicial redistricting. Um, but she's leaving it to the end. She will, after this 10-day period has expired. How she's signing 155 bills in 10 days, that's going to be interesting. I've gotten a few phone calls, some harried phone calls from their office. Um, but fingers crossed, because that was a long time coming, the medical aid and dying bill. And someone asked, when is my next town hall? That will be in January. We'll do kind of a budget predictor. I'm gonna try to do it after the state of the state, so I kind of get a vibe for maybe what we're going into the budget talking about, so I can give you guys some information. But of course, if you have any questions, you can always reach out to my office. Happy to play speculative games about how late the budget's going to be. That's always fun. Um, okay. Thank you again to Sarah and Diane. Thank you to Chloe for hanging out and helping to organize this. Thank you to everybody who came out tonight and asked questions. If you have additional questions, you have the number directly for community health advocates. You have our phone number and email, and we will be sending out a recording of this to everybody who registered. So if someone you know missed it, but they're registered, they will get an email. So thank you guys so much. I appreciate you.
Thank you for having us. Again, our number is 888-614-5400. Good night.
Good night. Thank you.
Good night, everyone. Thank you.